doctor.
Right, exactly, right. So they rely on us to answer a lot of their questions related to how they feel and how they look and how they function.
But you know, trainers right now without any, just some basic standards. I mean, we have some work to do in our area. We need to up the level of professionalism. How do you feel about this kind of trainer education program that we're starting here at the Healing Arts Academy?
I think it's going to be very strong because of the multi-dimensional courses that they're going to be taking. There's a real strong focus on biomechanics and anatomy and especially the function of the skeleton as it moves through day-to-day life instead of just segmented pieces of the body.
What are some of the things you see just working in different gyms and seeing different trainers? I mean, it's hard to be critical of some other people in your field, but we do see some things sometimes that cause us to question the trainer's education. What are some of the things that you see most often that kind of make you go,
Yeah. I think the biggest mistake that I see is that trainers will only use one joint at a time. They'll only train one body part at a time. And in life and in sports, we use our entire body. So it's important to use many joints and many body parts when you train somebody so that it applies to their day-to-day living.
So personal trainers today in 2010 and moving forward really shouldn't look to the bodybuilders of the 70s and 80s that focused on isolation and trying to get the prettiest bicep. That doesn't help us function
Right, exactly.
better in our life. So the average training client who might not be a professional bodybuilder and may not be a champion athlete that just wants to feel better and function better
Right.
would be better off with a trainer that's educated in how the entire body works.
Absolutely.
So what are some of the things that really address that the body works as an entire unit or not in just that old-fashioned bodybuilding way? I remember, I'm old enough to remember, that the machines set up in gyms, you really only had one way to move things, and
Right.
those are called planes of movement, correct?
Right. So in old-fashioned gyms, you're really only using the forward and back motion or the sagittal plane. And again, in life, sometimes we move side to side, sometimes we have to rotate. Even something as simple as reaching for our seatbelt and clasping it requires rotation. And because we are not all properly trained in that plane, it can lead to injury.
So one of the big buzz terms right now in almost any exercise is they say the core, which I know is not a newly discovered muscle, but it's a series of muscles
Right,
that runs kind of the center of our body like a corset around us.
right, exactly.
So instead of just 1970s, 1980s crunches to strengthen my abdominals, which are kind of the center
Right.
of our core, how would an educated trainer teach an average client how to really develop all of those muscles, strengthening their abdominals, but all of those core stability muscles instead of a crunch?
Right. The first thing the trainer would have to do is really educate themselves on the anatomy of the core. And like you said, it's not just the six-pack anymore. It's the muscles that encircle our waist and runs to our lower back. And the trainer also has to understand the functional anatomy of those muscles, not just the names of them, but where they attach, where they insert, and which planes they move in, and then translate that information to the three different planes of motion when they train their clients.
Give me a couple examples of what you would tell me if I was your client, ways to train my core, including my abdominal muscles, because I do want that to look good and I want to feel good.
Right.
But instead of just old-fashioned crunches, give me an example.
So a good example would be a chop. As I mentioned with the seatbelt activity, we have to rotate in life. So a chop would look like maybe taking a weight like a medicine ball, and then you'll hold that by one hip, and then chop it over your other shoulder. And then start back at the other hip, and then chop over the other shoulder. And you can use as big a range of motion or as small a range of motion.
So I feel everything working here.
Exactly.
So I'm working my six-pack muscles,
Exactly.
but I have my other muscles surrounding and even strengthening my
Your
back.
lower back, exactly.
Okay.
And we're bringing in the hip and the shoulder, which connect the core. So it's a functional kinetic chain movement.
So an old-fashioned crunch, you say, is in that one plane, the sagittal plane,
Right.
and this is involving more.
The transverse plane. Yeah.
Okay, what if I get bored of that? What's another exercise I can do?
Another one you could do is to work in the frontal plane for the obliques.
And what's the definition of the frontal plane? I don't really...
The frontal plane is anything that can happen between two pieces of glass positioned in front of you and behind you.
Okay, so this little skinny plane.
This little
So
skinny
if I'm
plane.
standing between my two pieces of glass and I
Right.
take this piece of
Stand
rubber
on the
tubing,
band. Yep. Open
Okay.
your stance so you have some resistance on the band, and
Okay.
then we're just going to do a side-to-side lean.
so the glass is in
Left,
front and
back.
the glass is behind,
Right.
but I'm bending, and so I'm working now these muscles more on the side.
Exactly. those obliques that connect the rib cage to the hip bones.
Okay.
And you can either do it on the hands or on your forearms, depending on how strong your arms are.
All right, so if I'm here,
And then lift your knees up and give me a nice straight line from shoulders to hips to heels.
Okay.
And by engaging your abs,
I feel all of them.
yep, engage your abs and kind of pull those pelvic floor muscles up towards your rib cage, and we'll just hang out here for 30
So
seconds.
this is instead of crunches. I
This
think
is
crunches might be
instead of
easier.
crunches. So here
Okay.
you're working the big six pack, but you're also working the stabilizers of the lower back.
Well, those are really good examples, and I think that does emphasize that the importance of education for trainers. I'm excited about the program here. I think educating all of the trainers out there and setting minimum standards can only be a good thing. I would assume that doctors would even feel much better about recommending their patients to trainers if they knew that they came from a good educated background.
Absolutely.
Well, I'm glad you're a part of this program,
Yeah,
and
me
I can't
too.
wait for it to
Thank
start.
you.